Thank you, Mr. President. Mr. President, just yesterday, the White House held a forum on empowering women. Sean Spicer said that, quote, the president made women's empowerment a priority throughout the campaign. But earlier today, Vice President Pence traveled to the Capitol to cast a tie-breaking vote to move ahead on a bill to undermine women's access to preventative health care. That doesn't sound like women's empowerment to me. Title X was enacted in 1970. It passed the Senate unanimously at that time and was signed into law by a Republican president. Title X is the only federal health care program dedicated solely to providing comprehensive family planning and other related preventative health care services so important to women, as well as preventative services for men. Last year alone, 4 million women and men at 4,000 health centers all across our country got basic care because of Title X funding. Critical Pap tests to head off cases of cervical cancer, counseling to help women plan for a healthy pregnancy, contraception, breast exams, HIV testing, vaccinations. These services prevented 87,000 preterm or low birth weight babies and 2,000 cases of cervical cancer. These health services also save money. The taxpayer saves $7 for every $1 invested in preventative health care. And for more than 2 million people, the Title X funded clinic is their only source of health care, only source of health care. This matters for small towns and rural communities all across Michigan, as well as all across the country. Title X funds clinics in 3/4 of all the counties in the United States. In Michigan, you can benefit from these services in the beautiful Upper Peninsula of Michigan, where I will be this weekend, where funds support the health department in Iron County, or the Planned Parenthood Clinic in Marquette, to the opposite end of the state, down in the southeastern corner, where funds support the health department in Monroe County. So what are we voting on today? Plain and simple. This is an effort to take away women's family planning and other healthcare services. Right now, Title X funds are awarded solely based on the provider's ability to serve the patient, as it should be. Republicans want to discriminate against certain family planning services, certain providers, and reduce access to this care, frankly, based on politics or their own personal beliefs. The vote this afternoon is very simple. It's about basic health care for women. A vote yes is a vote against women in Michigan and all across our country. A yes vote will take away health care. A yes vote will take away health care for millions of Americans. I strongly urge my colleagues to vote no. Thank you, Mr. President.